One question I get asked all the time is, when should I start icing? Should I use ice? Should I use heat? How often should I be doing it? What's the best way to do it? So I thought I would just shoot a quick video just explaining the latest research that I came across with regarding this. Now, the first thing you want to be doing is working out whether this is a brand new injury or if this is a chronic injury. So a brand new injury would be going over your ankle. You did it there and then. This is not an ongoing issue. So if it's a brand new issue, the first thing you do not want to do is use ice or heat at all within the first 3 days. Now that may be different from what we've commonly heard before, if you sprain your ankle, get ice on it straight away. Well, what they're saying is that if you put ice on that straight away, what you're going to do is get rid of that inflammation. But that inflammation at that stage, within the first 3 days of an injury, is actually really important. And the inflammation is there to break down any of the damaged tissue so that the healing process can then start. So if you actually use ice within the first 3 days of a new injury, you will slow down that healing process. So the first thing you need to do is don't use ice within the first 3 days. After those 3 days, you can start using ice, but what you need to do is use it in conjunction with heat. So you want to put on ice and then heat. You can do 5 to 10 minutes for each and repeat that. Now, if it's a joint in the back and it's quite deep in, the more often you do that, the deeper it's going to get into that joint. So you want to be doing it at least 10 times, but as often as you can. Now, keep alternating the ice and the heat. Now, the ice will help take away the inflammation and the inflammatory chemicals out of that joint. The heat will then bring in blood supply, which will create a flushing movement and help really get rid of all those inflammatory chemicals. If it's a chronic issue, okay, so this is something that's not brand new, you've had it before, it could be a back issue or something like that. If it's a chronic issue, you can start putting the ice and heat on straight away. You don't have to wait those three days. Getting it on and repeating that as often as you can is going to be really important. Again, just to do exactly that same, help flush out those inflammatory chemicals and really help with the healing process. So I hope that answers some of the questions, and it was maybe a bit of new information because it is different from what the RICE or the rest, ice, compression, elevation acronym is that we all have heard of. But this research actually came out a year or two ago. The RICE came out in the 1980s. So this is new research, and what we're saying is what you want to be doing is alternating ice and heat. If it's a new issue, a brand new issue, give it 3 days before you start that. If it's a chronic issue, you can start that straight away. So I hope that helps, guys.